I am Dr. Natalie Crawford. I am a board certified OBGYN and a fertility doctor, and I get asked about exercise when you're trying to get pregnant or going through fertility treatments, or you are pregnant all the time. So, this is going to be a quick video to break down what I want you to know about exercise during these different stages of reproduction. If you want to learn more about your body and support my mission to help educate people about their fertility, would love it if you would subscribe to the channel. Thank you. All right. Well, first, I think we all know that exercise overall is good. Exercise can be a way to build up your body, can definitely help prepare it for pregnancy if you're trying to get pregnant, and it also can be a great way to reduce stress. This is hugely important if you're trying to get pregnant. We know that stress and high cortisol levels can actually impact the brain and how the brain sends out hormonal signals, which are important in ovulation and in luteal progesterone production. So, stress can be one cause of not ovulating at all. And we think back about pre-modern world, stress was famine, a disease, a pandemic, a war, when you didn't have food, you had to migrate, you didn't have a home. Now in the modern world, people carry this chronic stress all the time. And that chronic stress is not something that the human body is really meant to adapt to. I mean, our body is supposed to release cortisol in relation to stress, and then it is supposed to go down. So I tell everybody, and maybe it's exercise for you, maybe it's not, but every single person needs some form of stress release if you're trying to get pregnant. 30 minutes a day for you. It's not too much to ask. It can be a walk outside in the morning or in the evening. It can be meditating or journaling. It can be getting a massage or acupuncture or exercise, whatever it is for you that can allow you to have that feeling of kind of release and letting some of your hormones drop down and not be as stressed as we are on a daily basis. But when it comes to exercise, what does the data support at these different stages? First of all, if we say, what about if you have certain disease types? For the most part, PCOS is the disease at question the most. PCOS is polycystic ovarian syndrome, and this is overall a disease where our body is not responding, our ovaries do not respond to the normal signals from the brain. So there is some brain-ovary miscommunication. Because of this, PCOS in general, I do not recommend PCOS patients undergo high-intensity exercise unless they're trying to lose weight. High intensity exercise, so those HIIT classes where you go all out and then you recover and you go all out and you recover, HIIT classes have been an effective way for weight loss. And because some people with PCOS are overweight and those fat cells can make estrogen and that can mess up the hormonal problem and imbalance even more, using HIIT workouts, 20 minutes of HIIT a day to try to decrease the weight burden can be effective. But outside of that, we know that HIIT exercise for some people can be more stressful, can cause a higher cortisol sensation. And so I generally recommend more moderate sustained activity for most people with PCOS, at least most of the time. Weight resistance, like weights and resistance training is great. Moderate walking or jogging is excellent. Leaning into yoga. That is stuff that is going to help your body, but also not stress you too much. Other disease state worth mentioning is hypothalamic amenorrhea. This is where the brain has sensed that there's too much stress from illness, stress, low calories, high exercise, and it is no longer sending out the signals to ovulate. If you have FHA, functional hypothalamic amenorrhea, we do want you to pull back on exercise, especially that high intensity stuff. Running, long, intense cardio sessions tends to be the thing here that is really flipping people over into an energy deficit. Try to walk, do yoga, do weights, do things more moderate, still build up your muscle mass. Trying to ask somebody who's used to running 10 miles a day to stop running altogether can also make you feel like you're not yourself. But I want you to lean into the fact that your body, if you're trying to get pregnant, wants to carry a baby. And in order to do so, it needs to be convinced that it has enough calories and energy to carry a baby. So we are trying to treat our body kindly and allow it to not feel too stressed out. And sometimes not having a period is a sign that it's being too overworked when it comes to exercise or calorie restriction. If you're going through fertility treatments, it depends on what you're doing about if you have certain restrictions or not. So if you're doing ovulation induction, which is medications like Clomid or Femara or injectable hormones to try to get an egg or a few eggs to grow, for the most part, you don't have any exercise restrictions because you're just like a normal human being out there on planet Earth. However, if you have a lot of eggs on one side, or if your ovary gets over 5 centimeters in size, specifically like if you're doing IVF, this is a definite, then your ovaries are so big they're at risk for something called ovarian torsion. I want you to think about the ovary in IVF that has all these follicles, about 1 to 2 centimeters in size, filled with fluid. So the ovary, which is normally this big, is now this big, and it's mostly fluid filled. If you can imagine a water balloon sitting in your pelvis, I don't want the water balloon to move, meaning I don't want it to bounce around. I want it to sit down low and stay there. And that's how I counsel patients. So no running, no plyometrics, jumping jacks, jumping, no yoga with inversions where that water balloon would move. But weights are still great. Yoga, as long as you're not going inverted, can be great. Walking is excellent. Low impact cycling, excellent. We do often want people when they're going through fertility treatments to stay active. It's just modifying what you are doing. And if you're at high risk for ovarian torsion, your doctors are not joking. Ovarian torsion is when that water balloon ovary bounces and twists on itself. And that cuts off the blood supply to the ovary. This is one of the few surgical emergencies we have in reproductive medicine. If the ovary gets no blood supply, suddenly you have severe abdominal pain, you might have vomiting. When you go in, depending on how long that ovary has been without blood, it might become necrotic or dead, and you might lose your ovary. That is the absolute last thing we want happening in this circumstance. All right, what about if you're doing IVF and you're having an embryo transfer? In embryo transfer world, things are a little bit different than in nature. In nature, an egg is being fertilized in the fallopian tube, and an embryo is developing as it reaches into the uterine cavity. In an embryo transfer, very often we are artificially getting the uterus to grow a lining, and then we are putting an embryo from the bottom up, and we are placing that embryo into the uterine cavity. For the most part, we don't want either extreme. I mean, I don't want you hitting your max heart rate all the time because in general, your body's not pregnant yet, and we don't want to shunt blood away from the uterus. But I usually say whatever you're doing throughout the other process is for the most part fine, as long as you're not doing something new or training for something new. There are different embryo transfer protocols. A controlled cycle when your ovaries are not growing any follicles, I give patients a lot more freedom with exercise than if they're doing a modified natural. Because if you're ovulating and growing eggs, your ovaries are going to get bigger, and now you have torsion risks again. Interestingly, one thing that people ask all the time is about bed rest after their embryo transfer. Embryos implant in the human body while people are up and walking around and living their lives every day. IVF is no different. And in fact, a study looking at bed rest immediately after embryo transfer, so waiting in the recovery room for 10 minutes or so, was associated with a decrease in implantation rates. So that leads us to think, no, you should get up, empty your bladder, go on with your life. So the exercise for the embryo transfer will depend on what protocol you had to grow that lining. Now, in early pregnancy, I don't love patients maxing out their heart rate. So I usually tell patients I like to see a max heart rate of like 150, 160. Officially, there's no recommendation here though. So it's not that, oh my gosh, a heart rate over that is worse in pregnancy. And ultimately, everybody is a little bit different. My max heart rate is going to be different than yours. What we typically want to do, especially in the patients I see who are going through fertility treatment, is know that we're doing everything possible. Miscarriages happen and they're not your fault, but I don't want you to have a shred of doubt. I don't want you to go, oh my gosh, I went on that run, or oh my gosh, we had intercourse. So I usually tell people, that moderate exercise, yoga, weights, light jogging, walking, low impact cycling until we get to the heartbeat stage. Once we get to the heartbeat, we feel a lot better that we can go be normal because we're already achieving a milestone. If you've undergone an embryo transfer, I don't usually release patients to be perfectly normal until that placenta is all the way grown in, which is when you'll be stopping your progesterone medication. But once we see a heartbeat, do allow more activity overall. A few other things to just know is that your body changes as you get pregnant. The progesterone causes your ligaments and your joints to be looser. You're more prone to injury. Your balance is going to start to be off. You get dehydrated faster. So stay hydrated, watch yourself and watch your balance. Listen to your body. Know that you're not going to be able to do everything that you could do in the past. And know that we don't love you in heat. Hot tubs, saunas, hot yoga, those things become off limits once you're pregnant. And especially once the uterus starts to get out of the pelvis, so once you get a little bit further along, we don't want anything that could cause trauma where your uterus could take an impact. So, horseback riding, downhill skiing, anything that could cause trauma to that uterus will also be restricted, usually towards the end of the first trimester. Again, exercising is good. It is really good to keep cardiovascular health, to get your muscles strong if you're trying to get pregnant, and it will have better birth outcomes if you exercise. We want to encourage exercise. When you go through fertility treatments, though, things are different because your risks might be a little bit different. So please make sure you clear any exercise program you have with your team. I certainly have had patients who are training for a marathon that we've had to pause or adjust their training schedule based on where they are in an IVF cycle. So just be upfront with your team so we can look out for you the best. Overall, hope this video helped answer some of your questions. Feel free to ask more in the comments. If you want more information, you can always listen to the